Uh, Dr. Ranjan, can you hear me?
Yes.
Yeah, so I'll just introduce you and then you can start.
Okay.
Hello, everyone. Good afternoon. Good evening, actually. And we have Dr. Ranjan Ghosh with us today. He is an MD and an MBBS in psychiatry from the US. And he is the founder of Good Karma, American board certified in adult and pediatric psychiatry. So today he's going to discuss, and we hope to have a fun interactive session with him on anxiety and disorders and how to deal with our stress during this pandemic situation. So I request Dr. Ghosh to start with his presentation and requesting everyone to put in their questions on the chat.
Hello, everybody. Hi, guys. So today we aptly named the lecture actually a pandemic, but surviving the epidemic, because basically what we're going to see now is from this pandemic or COVID scare, we're going to see actually an epidemic of already the cases that were astronomical in India. So 2 years ago, I came back to India to tackle this problem, and the suicide rate was already very high. And I think it's very important to understand that our suicide rate is inversely proportional to the rest of the world, which means that age 15 to 29 are more likely to commit suicide than older males. So if you think about that for a second, and you think about all the things that we're facing during the pandemic, this is what this lecture is about. And in some regions, there were other crises and getting used to working from home. All these things would be addressed here, as well as what to do when you feel that tension coming on and how to prevent it from actually even coming on. So thank you for joining in. I hope it's an informative session for you guys. So the first thing I'd like to do is let's even go back to COVID, post-COVID. And this is also for medical professionals, but I also want everybody to think about this for a second. Post-COVID, we already had a high problem with medical professionals having depression, with all of society having depression. In fact, 1 in 5 even. So that's only the ones that are documented. As well as when you think of bipolar disorder or mania, a lot of people don't even want to admit to those things. And we'll talk about that in a second. But that's pre-COVID. Good Karma started an initiative of 3 things, believing in 3 things. We would break the stigma associated with mental health treatment. Number 2 would be mental health awareness, because if you don't know this is even symptom is being caused by tension, then how can you treat it? And also prevention, like starting young. What is social emotional development, like to that level? So, and the third thing was accessibility. So accessibility, we're really working really hard on these things. We were doing that post-COVID, and already we're having astronomical problems all around India. That's all I wanted to say with these slides. There's a lot of studies here, but here's the recreational things that we were doing. Yeah, as busy professionals, maybe we didn't take advantage of them, but yeah, protesting against doctor violence, opening good karma, in the gym with my trainer, Sri Pranav Mukherjee, then, hanging out with your friends, watching the Avengers, the latest Avenger movie, going, traveling to Darjeeling, doing things that you want to do, running suicide campaigns, going to Reserve Bank of India, having a birthday party with my father. Those things are so dear, right? Think about it. All those memories that we had and we were building got arrested in a way. And yeah, sure, we like sometimes work from home, but it is isolating to know that we can't go to these things. So now we're resorting to these things, which is progressing into online consultation, having things like this red zone cipher for at least people to express themselves when they're at their darkest, and they can just express themselves in any which way. Having these webinars, like we're having now, things like this, being on guest appearances, as well as binge watching Netflix and watching those things. But we're going to show how to do everything in a balanced way. And I just want you guys to know that life has changed, and adapting to it and having those stages of grief and loss is normal. So that's what we're actually going to deal with and talk about today. So what are the things that we're seeing the most? What fears as patients call in, or as just anybody, relatives, anybody, friends that are asking for help? They're asking because of these following reasons. They have a fear that something might happen to them at their job or be exposed to something. They also have a fear that their loved ones might contract it from them, or they might contract it themselves. There's also a fear of financial issues, because if they don't go to work, or the job security market has been really tainted actually now. So now I think these feelings of hopelessness, we switch from a mindset of living, which is living in the moment, enjoying every breath that we take, to survival, which is led to the depletion of toilet paper in the United States, or led to the absence of dal and chawal and tel in the first weeks. So those things are survival mode, and when that has started in one's mind, in some people that are resilient, they're fine. But if some people have some issues with anxiety, this can really actually stem to another further type of depression. So this was my empathetic lecture. So this is some of the symptoms we see when you basically have a panic attack. So if I can describe some symptoms here. So you have an increase of hydrochloric acid, which then causes like a gas chest pain, and the chest pain then causes an increase in heart rate. You have trouble breathing, and you start having a headache maybe, or even you have dizziness, and as well as tingling of the limbs, and sometimes people even pass out. This type of tension is normally treated by all various professions. So if I have a stomach problem from that exact same tension, I'm going to the GI doctor. Then I'm going to the cardiac doctor. Then I'm going to the pulmonologist because of my difficulty breathing. But in actuality, those might be actually normal, and the person is actually having a panic attack. So it's very important to understand that the command center of your whole body can really affect you. And it affects your whole body, actually. So how do we take care of ourselves? We feel taken care of when we socially connect. So make time to unwind, be with your family, connect with them. If they're the source of tension, connect with others. It's going to take a lot of adjusting. So connect with people. We have this hotline because people sometimes tell me in these chats even that, hey, I don't have anybody to connect with. And, to that I say, I don't want anybody to be alone during this time. And we have a hotline and we have people that, are dedicated to, answering that. And even I answer it sometimes. So those things are there. Those things, those alternative measures to knowing that you're not alone. And yeah, special considerations always to the elderly. Have them stock up on things. Make sure that their medications are there, as well as people with mental health challenges and disabilities, special disabilities like autism especially. When that aberration happens or the change, it's very hard to deal with. So yeah, to the special ed moms and dads, I understand. It's a difficult situation all around, but the elderly have a much harder time because people sometimes say that they might be just cognitively declining or getting older, but they actually might be in depression. So it's hard to tell. Concern about protecting oneself from the virus because they are at higher risk of serious illness. This happens all the time. We just discussed it.
Dr.
Yes.
Ranjan, just interrupt once.
Sure.
I actually have a small question.
Definitely.
As you mentioned in the last slide, in the previous slide, that elderly people have a lot of stress, especially during this time.
Sure.
So how do they cope with it? Do they actually seek help? Because I think, especially the ones who are a little older, they still feel that it's a taboo to even speak about it.
Exactly. Very good question. So the peer-to-peer support was what I call that. I like to make people active listeners that are non-judgmental and that know their grandparents or parents, that they can gently nudge in that direction and say, hey, I remember when you were like this. Can we please talk about it in a way? So that's that peer-to-peer support. If indeed it's an organic depression, you just say that, I care about you and this is like a medical appointment like anything else. Please attend it. And just like that. And it could be a simple medical adjustment, like they had too many high blood pressure medications and it was making them a little bit more down. It could be anything. So yeah, it's always good to explain it in terms like that. A very pragmatic approach, like this is medicine and this guy knows what medicine does to your mind.
Okay. But still, I would say they usually don't speak about depression, or even if they're stressed, they're going to keep it within them. And their situation deteriorates after that, after a point of time. Their condition.
Well, if you feel that they don't speak about it, then we have to then, intervene if it's that bad, because we can't only treat the suicide, if you will, right? When the suicidal thoughts come, we should be preventative. So we really need to, impose our will in a way and create a mental health advocacy in such a strong way. Like good karma is doing, and really join hands and fight for the people to understand that social expression happens and you need to do it. And that's why I'm saying we have to do to goal 3 and what I was telling you about prevention. We need to start the generations this way.
So you're suggesting that a voluntary nudge always helps?
Yes. Definitely. So, but yes, support your loved ones. That's what show them you care, so they trust you to express themselves to you as well. So, I'm going to just continue about so people coming out of quarantine, I guess, are especially ostracized. So I just went and talked to you about the mental patient, quote unquote, the pagal ka doctor. That's what I'm known as, right, in India. So what I'm saying is that the stigma associated with seeing mental health has to be altered in people's mind. And that's what I think with the pandemic, it's exposed a lot of issues and made more people more maladaptive. So it's easier to pitch my marketing of mental health will save you because of the fact that they're more susceptible in this time of pandemic. And I think they can hear the message now. So coming out of quarantine is a very, very, very tough situation. Just like that mental health stigma I just shared with you, it's like that for COVID patients. COVID patients are considered like untouchable type of situations, and even after 14 days and 30 days, 60 days after testing negative even, there have been instances where they have been made to feel less than or not looked upon or not even connected with. So what I suggest is that, make sure that we show them our support into your comfortable level. Like, reach out by video chat even, call, make sure you're connected to them. Don't leave them in that crisis time, as well as protect them from certain things. And then also to our healthcare professionals who, work so hard and then they come home. The precautions are taken very much so, thousandfold so than any home. So let them be in peace. Let them, enjoy and be at home, because if we give them tension, and at the levels we're seeing, medical professionals are also, contemplating suicide more, and those things, we cannot drive them to that level of tension and stress. So that's what I'm suggesting, is that we do not label people based on a virus that nobody has any control of, and it's just like a Russian roulette of symptoms and almost a spectrum. So this is a very important thing going forward, to tell anyone you can, spread awareness on, from the rural level to all the way to the urban. And then, especially for children, we want an extra attention on sadness, anger, frustration. Yep, and for providers, like I said, ensure that you have that quality time, that you decompress from even social media. Take care of yourself. I'll show you in a while with the 5 ways of wellness. But make sure you try to let that go. If you can't let that go, talk about it. Let it out with somebody. I'm always there. Let it out. And, do the 5 ways of wellness, which is to be connected, take notice, give, keep learning, and be active. Such. But I think, are there any questions before I go on to this?
Yeah, Dr. Ranjan, I have a question. Sudarshan, I can continue? Hello?
Yeah, go ahead.
Yeah. I have a question from one of my friend who is working here in Kolkata. but he's not from Kolkata. He's from outside Kolkata. So he is staying here alone and working from his home. So he is facing a lot of problems. Like he is facing issues, he's having withdrawals, like he's having an aggression, but he actually doesn't know what is the reason of it.
Okay.
So in that case, what he can do? I mean, you have already told that we can connect, we can talk over and whatever. So what actually can help him?
Okay. So that's so. I mean, I'll tell you the prevention then later, but in that case, there's so many things I want to say actually. So the first thing I'll say is this: we as human beings never have anger as a primary emotion. It's always something due to something. So my job as a psychiatrist is not to read palms. I don't know astrology or numerology, but is to like really analyze why it's happening. So in your case that you just mentioned, there's so many different questions I would have, but in regards to that, if he has uncontrolled anger without drugs or alcohol, then it might be so many different things, from regular depression to anxiety to bipolar disorder, mania, to so many things. So that's what I was getting at with that.
Mm-hmm.
You can treat it. We just need to look at what it is actually.
Yeah. So I can just tell him to go to good karma, and he can just treat himself, right?
Definitely. I mean, now we're 100% online to reduce the stigma, as well as doing forums like this to educate people. I really appreciate you guys, and it's thank you so much for the question.
Yeah, thank you for the answer.
I have another question actually.
Sure.
What happens after the patients, or I would call them patients, the one who are affected by COVID, once they're cured, okay, even if they are hospitalized or not hospitalized, they come out of it. Is it, what happens after that? Are they still treated or kept in quarantine, or they can move about? Others around them need to be careful. Thank you. I think
great question.
That answers the question. We can continue.
Okay, sure. When we get into Be Aware, I'm going to spend some time on this. I think all the slides that I wanted didn't get uploaded, but it's fine because I wanted to spend some time talking anyway. And this is a really important thing to do, and the most important of all our 5 W's that I didn't put in order on purpose this time, because this is the last thing that we have to teach people to actually be within themselves and not think about anything except being in the moment. And that's tough. So in fancier terms, it's called mindfulness. I just call it like the good karma pranayam and deep breathing techniques. And there's also simply other kinds that you can follow. But I think that if I see something like this object and I like it, and if I can just look at the object, not in too much detail, in generalities, without thinking about much of anything else, without my mind wandering, and then me slowly bringing it back, if I can practice doing that for like a minute or two a day, it's better for you to start that way. As well as while you're doing it, you can either close your eyes or really think about this for a second. You can close your eyes and think about a door opening and shutting, or you can focus on that beautiful object without thinking about it too much, as well as doing this breathing exercise. So I'm going to teach it today. It's very important to practice when you're relaxed, because then when tension happens, you can employ it and put it into use in action. So and I'll have you guys do it as well if you guys want to. That would be nice if you'd like to. But the main basis of this is that you're trying to close down all negative thoughts and focus on your breathing. And the only time you can focus on breathing sometimes, because the thoughts are so great, is focusing on the door that takes 3, 2, 1 to open. And as the door opens, I'm taking in through my nostril, filling out my chest cavity, all the way to my stomach, pushing it out, and not holding, but then out through the mouth. And that's when the door would be going this other way, 3, 2, 1. 1, 2, 3, 3, 2, 1. In the world of Apple Watches and stuff, they have actually a balloon that goes up and down, and they also do 3 seconds. But yogis and deep meditators, I think, do 5 seconds. But it's tough, but I want you guys to practice it today so you can use it later. And if you have difficulties, don't feel bad. That just means you have some anxiety. I do this in all corporate events and environments, and you'll be surprised, teachers especially, sorry, and you'll support and help. And do the 5 W's if you can, and slowly it might come back. So here we go. We close our eyes, if you will, and you watch one from me first, and then you can join if you'd like. We do 5 of them. But as I'm gonna push in, my air is gonna come here and out through my stomach, and then out through my mouth. Okay, and I'll count initially for you guys as well if you'd like. But let me just do it with you first. Okay, so 1, 2, 3, go. Now slowly open your eyes, and you'll find yourself in a different state if you've done it properly, because it stimulates the parasympathetic plexus, and when it stimulates the parasympathetic plexus, it tells your relaxation or your tension center, the sympathetic plexus, to just halt and cease and assist, and just to relax. And so if you can practice doing those things, these 5 ways to wellness, I feel like you can prevent any mental health stuff from happening. And you can even make it a game with your children. There's worksheets that I've made for parents as well. And it's something that we need to keep in mind as our social connections are arrested for this time being. Are there any other questions or comments or anything?
There are questions. Should I go ahead?
Yes, please. Let's shift out of slide mode, please.
Yeah, so we have a question from Shantan Ghosh here. He's asking that I feel there is a social anxiety with this prolonged lockdown. Since we're not interacting with too many people, then it'll be difficult to socialize now, especially now, when the lockdown gets done with.
Right.
How do you think we go about that?
So that's what the connection part of my 5 W's was, because if we don't connect, we actually have no possibility of doing better in regards to our mental health. We isolate, we tend to not then connect with anybody, and we start making a bad cycle, a poor coping skill, if you will. So that's why we see more isolation, more alcohol or drug abuse, more kind of domestic violence, because we're not connecting even in this time. And we really need to, as a society, connect at this point. By this medium is all we have at this point.
Thank you. I think that answers the question. Mr. Rahman here is asking again the next question. He wants you to suggest something for his 3-year-old child who is now literally in lockdown, like locked in a room due to the situation. So
locked in a room?
Yes, as in the house.
Oh, okay. I was like, what? Don't lock him in the room, please. That would be another type of problem going on. So yeah, in regards to the quarantine,
just and completed. He's saying that past 3 months he has never moved out, gone to a park maybe, or for shopping. So how much this will damage his or change his behavior pattern?
No, definitely. Yeah, it's a very good question. Again, we are people of creature habit. And the new habit is alarming, but we have to lean on that and use what we have to connect to others as for him. How old is he again? Do you remember?
He's 3 years old.
3 years old. So yeah, it won't have an irreparable damage because socially you're there with him. But if indeed he can have some cousins or some sort of interaction with other people that are safe, I think would be beneficial, as well as to getting him to used to being careful and with interactions at this age until we can find a better method. Actually, just teaching him this now is not going to affect him, because we can also change that thinking if we do it appropriately through communication with the child. That's what we do in child psychiatry or child therapy.
Thank you. We'll move on to the next question.
Sure.
Uditi here is asking, many people are complaining about their sleep pattern in this work from home situation. They're getting disruptive sleep in the night and then the next day experiencing drowsiness, drooping. What is your suggestion to improve this?
So work from home is a huge issue. And because what's happening is that because of job insecurity that I mentioned, that people are working 24 hours sometimes, or like insane things, shifts, and then passing out. And what's happening, I think, is also that employers are knowing that because the less travel time, that they're getting more work time out of their employees, and the job market is also bad. And so there has to be a policy, I think, from the company level even, about work from home, first of all. Second of all, I think sleep is the most important thing you can do to think clearly, recharge your brain, and ensure healthy lifestyle, increased immunity, all those things. So the thing people don't understand about sleep, I think, is that if you have sleep, you need to get to REM in a certain amount of time. The NREM stage is 1, 2, 3, and we need to expand the REM to be the longest, because that's the one that we're the most rested. And so when I say light sleep, that means they're getting more NREM, less REM. And that's when people are waking up with all these intense nightmares and dreams and all these things because of the cycle being off. And so yes, sleep is extremely important. It's like probably the most important thing that I do for mental health. And people don't do it appropriately sometimes. They get addicted to benzodiazepines, and those medications are used for abuse. And in America, they're actually controlled 2 substances, which is, one is the highest. And so because why? The sleeping medicines, if not done properly or given ones that are not addictive, they actually can be addictive, as well as with alcohol. And those are the 2 withdrawals that you can actually die from, is sleeping pill withdrawal as well as alcohol withdrawal. if you detox from heroin, cocaine, PCP, ecstasy, all those drugs, then you won't get a withdrawal death potential. But with these, you have a withdrawal seizure with death potential. And that's why it's a very serious thing. I take sleep very seriously. Sleep hygiene is to be done first, which is no pad when you're in this position, the horizontal position, because then you're teaching your brain to be up. Actually, so supine position, when you're teaching your brain to be up and on while you're laying down, and that doesn't make any sense. So I always say, keep a chair like this, even binge watch, but binge watch on that chair, fall asleep, plug your phone in or whatever, and go to sleep. But it's rarely done. We have a bed culture in India and in this part of the world too. So it's hard to do, but we have to try. It creates sleep hygiene. There's other things you can do. Obviously, you can consult Good Karma for our Facebook page for more suggestions.
I'll just add to this question. It's a little related. Nowadays, especially students, I feel that they are really, they've turned nocturnal. They're not sleeping at night and they're sleeping the entire day. I think that is also one of the reasons of drowsiness, or they're drooping the entire day and then they're awake the entire night. Is the cycle correct? How do you rectify this?
Night reversal is not correct because daylight gives us also serotonin boost. So we really need to have a good circadian rhythm, as we call it, in fancier terms, I guess. So you have to have a cycle. When that cycle is off for extended periods of time, even if you see people that work at night, there's this thing called sleep shift disorder because their body gets habituated the wrong way. So no, when I tell teenagers, especially adolescents or young adults, you can binge or do it, but do it once a week. Don't do it every day because you're gonna have irreprehensible damage to your system. So I just promote those well-being techniques because I feel like if you don't do that, you'll be isolating yourself.
So thank you. I think that rightly answers Uditi and my question as well. There's another question here coming from Mrs. Deepshikha Chaudhary. Okay. She's asking how to increase the happiness quotient in our families now. We're in lockdown, we're at home, everybody's together. It's a very relevant question, I think.
Yeah, so there's two things happening, you should know. Either the divorce rate or the attention rate for divorce is getting stronger, or our families are living in harmony and unison. It takes a while to get there. It's something new, it's a new challenge. It's something we've always wanted or thought we wanted in our head. But does it actually amount to what we're getting? So when there's tension, though, I suggest you break away and do something and then come back to the situation. Because if you constantly kind of add pressure to it, it's bad. But to improve the family life, here's what I suggest as well. It's some cute little things like, if you have Dida's recipe of, a homemade dessert or a dish, you can be sharing that as a family story or tradition to your daughter or son, or working as a family to understand why that dish was so important, or what song was really important to grandma and why was it passed on to you, or anything of that nature. Connecting with your family in various ways, giving them identity, helping them feel that they're secure and loved is important, I think.
Thank you. I think these are the questions which were there. Okay. If there are any other questions, everybody's requested to please post it. Or I think for now, these are the questions.
Yeah, so Yeah, definitely. So if you guys think about it, and I guess this is my question to you, for mental health advocacy, what are you willing to do? Because like I just said, we have the highest suicide rate in the world. Enough is enough, and we need to act. We have an extra layer of what society is going to think as a problem in our country. And we need to eliminate that and bring it to the moderate level, because that is an added pressure that people cannot tolerate. And as I've progressed as a psychiatrist here, even in India for the last 2 years, I've seen this an abnormally high rate that I wouldn't have seen in America, which is the polar opposite. That also is not good, which is I don't care at all. So we have to come to a fine medium. If we don't, and if we see this extremist kind of attitude, it's going to be a hindrance in your mental health and well-being. And that's why I'm asking you, what are we prepared to do to like spread the message, to really form as a group, connect with people that we normally wouldn't, and really reach out. And so that I think that my question to you guys is that I'm sure you've seen this in your families. I'm sure you've seen that you've had a discord or a dip, even though people are treating you nicely. These things are a depression. We just don't want to admit to that. We feel like it's a character flaw or weakness. That's why I'm kind of stressing on our viewers here. If they ever had a story, it's okay to share it, and it's okay to understand that maybe the treatment wasn't great, and maybe you didn't know that you had options. But now I hope that you understand that there are options out there, and you can actually prevent it and also do things that are safe to help you. So yeah, reach out, like tell us your stories, or tell us like, I have panic attacks, or I have anxiety. It's liberating, trust me. Like, I'll give you an example, okay? This is, I guess, as a raw example as I can give. So we deal with things like a detective. Psychological is in there. That's the middle part of what we call our biopsychosocial. Our bio is this, biologically, what's in our body, what medicines are someone's taking, how is our diseases or disorders being affected in our body. For example, thyroid, if you have increased thyroid, you have increased anxiety. If you have low thyroid, you have depression. And you have increased panic attack chances with thyroid. That's just one thing. If I just give an example, another one, corticosteroid usage in hospitals, IV, you can go into mania. So that's a biological example. Mixed with whatever symptoms I'm dealing with, as well as family history, is how I look at the biological aspect of things, and if any genetic things can be succumbed with this information. The psychological is that how the person has developed psychologically, how they deal with things, how are their relationships with their parents, what is it like now, how are things going on. Sorry, am I clear? Yes. How are things going on inside their inner workings? Like, I'll give example for me entirely. So if I'll do the whole thing, and then the social stressors, okay? So biological, maybe family history of anxiety. Sometimes symptoms are having sleeplessness, irritability, as well as chinta, excessive worrying about things that are not really pertinent, and not enjoying and living in the moment. Okay, that's the biological aspects of it. Then when I get to the psychological aspect, avoidant personality traits growing up, socially felt like mixing but was always trying to be a perfectionist, so didn't mix, and so on and so forth. So this is fascinating, right? And then you go into the relationship with parents, and then you go into the social stressors. So the social stressors are like this. Like, what are the active tensions that were happening in short term and long term. So that's how I come up with the whole formulation. And I try to do it in an effective, in a time, not a time, extensive time manner now. I've gotten good at it to where I can limit it. But that's what I'm saying is like, if you like expose yourself a little bit, then I think that it feels better to express yourself.
Thank you. I think we have one last question. I think it's very relevant as to end the session. Any suggestions for those who lost their jobs during pandemic? From the psychological point of view?
Yes, you always should have hope. Hope is a factor that we all need. Hope and purpose. So when you look at the job market and you look to reinvent yourself, I would strongly suggest that looking online and seeing something that you can do that's productive no matter what. No matter what degree in life you are, from low to high, you can always do something productive every day. And so to have a short-term goal and a long-term goal is very important. I think an attainable short-term goal is most important. So that creates purpose.
Thank you so much, Dr. Ranjan. I think those were the questions that we had.
Thank you. Thank you for having me.
Thank you thanks to the audience, and thank you. I think we had a great session.
And I would like to tell all the attendees that we'll be sending a link in your email for the feedback of this session. So if you can give the feedback, that would be good for us. And eventually you can get your certificates. Thank you very much.
Thank you very much.